To attach the extension feeding tube to the G button with the Button Huggie applied, first open the feeding port cap. On the lid of the Button Huggie, you will notice indents on both sides. Place your forefinger and your thumb in the indents on either side of the Button Huggie lid. Pinch firmly to stabilize the G button. Line up the line on the extension feeding tube with the line on the G button. Insert and turn. The extension feeding tube is now attached. There is a hole in the corner of the Button Huggie lid to help prevent feeding the bed. To help prevent feeding the bed, take the cap of the feeding port and insert it into the hole at the corner of the Button Huggie lid after the extension feeding tube has been attached. This makes it more difficult for the extension tubing to rotate back around. When it's time to remove the extension tubing, take the feeding port cap out of the hole at the corner of the Button Huggie lid, rotate the extension feeding tube back around, and pull the extension feeding tube out. Recap the G button feeding port. If you look at the Button Huggie lid closely, you'll see finger indents on the sides of the lid. When attaching the extension feeding tube to the G button, it is important to pinch the lid inward. When you pinch the lid inward, it engages what we call the edge grippers of the internal mechanism, allowing them to come underneath the G button, stabilizing it so that when you go to insert the extension feeding tube, it doesn't push the G button down like so, and instead it stabilizes it so that the extension feeding tube can be attached. For most patients, the G button exits the abdomen straight up and down. But for some patients, the G button exits the abdomen at a bit of a tilt. If the G button exits the abdomen at an angle like this, and you go to apply the Button Huggie to the G button, you'll notice that the G button doesn't sit correctly inside the Button Huggie. And this makes it difficult or impossible to attach the extension tube. An easy way to tell if the G button is sitting correctly inside the Button Huggie is to look downward on the lid. If you notice that the feeding port of the G button is not centered in the hole in the lid of the Button Huggie, that means that the G button is at a bit of an angle. In order to fix this, you can simply rotate the G button 90 degrees. This typically means rotating the G button so that it is parallel to the patient's body. Once you've rotated it, you'll notice that the G button comes out of the abdomen straight up and down. And then, once you apply the Button Huggie, you'll notice that the feeding port of the G button sits in the center of the hole of the Button Huggie lid. You will now be able to attach the extension feeding tube more easily. For smaller babies, you may find that it's easier to close the Button Huggie lid and attach the extension feeding tube if you apply the Button Huggie when the G button is vertical, parallel to the baby's body. Once the Button Huggie is applied to the skin, you want to make sure that the lid is completely closed before attaching the extension feeding tube. If you are right-handed, then you will want to use your left hand to pinch the lid of the Button Huggie inward when you attach the extension feeding tube. If you try to pinch the Button Huggie lid from the top, not only do you risk pushing downward on the Button Huggie instead of pinching the lid inward, but when you go to attach the extension tube, your thumb will likely get in the way. Instead, keep your hand closer to the patient's abdomen with the U of your fingers matching the U of the Button Huggie lid. Pinch inward without pushing down, insert the extension feeding tube, and rotate. If you find, when you go to attach the extension feeding tube to the Button Huggie, that the lid is popping open, that means that you are pinching the lid of the Button Huggie too hard, or that the lid of the Button Huggie was not properly closed to begin with. If you find, when you go to attach the extension feeding tube to the G button, that the G button is being pushed down and you cannot attach the extension feeding tube, then that means that you are either not pinching the lid of the Button Huggie hard enough, or that you are not holding the pinch while inserting the feeding tube.